I am Dr. Bharat Purohit, Senior Consultant Cardiologist and Director of Cath Lab at Yashoda Hospital, High-Tech City. I will be telling you about some of the breakthrough interventions, breakthrough technologies which has come up in treatment of heart-related disease. I will start with the most important and most commonly affected disease in the society, that is the high blood pressure. We all treat them by medications, but nowadays we have a therapy called renal denervation therapy, which is very similar to how we do a coronary angioplasty. Here we put a catheter in the kidney and then we deliver some waves which will destroy the nerve fibers which are around the kidney arteries, the renal arteries, and by which we can stop the feedback mechanism to the brain which leads to development of hypertension. So that is something very novel and new in patients who have got uncontrolled hypertension despite multiple drugs, more than 3 drugs. In them we recommend this therapy. In coming to the most common disease which is affecting the heart attack and the use of angioplasty, the breakthrough technology is the development of dissolvable stents. These stents normally we know are made up of metal coated with a drug on this, called as a drug coated or drug eluting stents. Now we have stents which are made of dissolvable material. They are deployed in the body, in the coronary arteries, and within a span of 2 to 3 years they will get dissolved from the body and it will be as if you never had any angioplasty. So that is a very novel therapy. Third innovative technology is in terms of valve therapies. Earlier, any patient who have got any valve related issues like mitral valve or aortic valve or pulmonary valve, the only treatment was a valve replacement, open heart surgery. Nowadays we have valves which can be deployed without any surgery. We call them as transcatheter valve therapy. We can replace aortic valve in a patient who has already had a previous bioprosthetic mitral valve surgery done in mitral valve area. We can again, if that valve degenerates, we can put again a percutaneous valve there. In patient who have got problem with the pulmonary valve, we can deploy a pulmonary valve transcatheter without any surgery. In patient who has got a severe tricuspid regurgitation, the tricuspid valve is leaking significantly, we can put something called a tric valve there. And in patients who have the mitral regurgitation, we have something called a mitra clip which can be deployed and reduce the leakage of the mitral valve also. So that is about the non-surgical treatment of valve related diseases. In patients who have got electrical abnormality, who lands up in arrhythmias, we have a new diagnostic therapy called 3D mapping system. So these new 3D mapping system helps us in treatment of most of the irregular heart beating which are happening to the individual. In terms of pacemaker technology, nowadays we have a new kind of pacemaker. We call it as a leadless pacemaker, where you don't have to do any surgery or you don't have to put any wires which are generally done when we deploy any pacemaker. So these leadless pacemakers are like a tiny capsule which can be inserted through the groin and the next day patient can get discharged. And last but not the least, in patients who have got irregular heart beating called atrial fibrillation, to prevent them from getting brain stroke, we deploy a device called LA appendage occluder, which after deployment will remove the need for using an anticoagulant which has a high risk of bleeding in these subset of patients. And after doing a LA appendage occluder, we can continue the patient with only aspirin without the need for any more anticoagulant blood therapy. So friends, these are some of the new therapies and breakthrough technologies which are coming up and which can treat the patient without surgery with good outcome. Thank you.